Welcome, everyone. Thank you for joining today's webcast. My name is Joellen Meckley, and I am the Managing Director of the Center for Special Needs at the American College of Financial Services. Today's presentation will be about retirement planning challenges and solutions for women and caregivers. Just be aware this presentation is recorded, and it will also be available on demand next week. We have a lot to cover today. So I am very excited to introduce our highly esteemed panel of guests for the discussion today. First, we have Ramsey Alwin, President and CEO of the National Council on Aging. In that role, Ramsey is leading a nationwide movement to ensure equitable aging for every American. Building on NCOA's 70 years of service and advocacy for older adults, she is focused on renewing the organization's commitment to improving the lives of millions, especially those who are struggling. And one of Ramsey's greatest strengths is sparking critical conversations about the resources that every American deserves to retire and age well, and what needs to change to ensure that all have access. Next, we have Dr. Kaylee Ranck. Kaylee is the Director of Research for the American College of Financial Services and is currently heavily involved in the rollout of the college's results and findings from our ongoing retirement income literacy survey. Kaylee will be sharing some insights from that research today, as well as sharing her insights as both a financial services professional and a caregiver herself. And last but not least, we'll also be speaking with Mary McDirmid, who is the co-founder of All Needs Planning, which is a financial advisory practice whose mission is to provide every family in the nation entrusted with a loved one with special needs the opportunity to receive the specialized planning that they need and deserve. Mary is not only an expert financial advisor and retirement planner, but also, like many of us, comes from the lived experience of having not only a child with special needs, but also having served as a caregiver for her aging father. So thank you to all three of you for being here today. I look forward to our conversation. So let's get started. All right, Ramsey, I'd like to start our discussion today on women caregiving and retirement preparedness by learning more about the research that National Council on Aging and the Women's Institute for Secure Retirement released this spring. Can you tell us a little bit about the study itself and specifically really what you found related to women and their confidence surrounding retirement?
Well, thank you, Joellen. Thank you for having me, and thank you for putting a spotlight on these really, really critical issues. It's such a delight to be with you and to share some of what we learned about what women have to say about what it takes to age well in America. So, for the second year in a row, NCOA partnered with the Women's Institute for a Secure Retirement to commission this bipartisan survey. And we looked at what women had to say at all ages and all life stages about what it takes to age well in America. So we surveyed women 25 and older, a special focus on lower income women, white, Black, Hispanic, rural women, and really wanted to lift up their voices and to hear what they had to say about the realities of aging and what might help. So, as we near our 75th anniversary as a national nonprofit, it was important for us to do this because we have always focused on those that struggle later in life and come up short. We've often used the socioeconomic lens to look at those issues and the issues related to low income older adults. But as we were unpackaging what some of the real factors are for aging into poverty and aging with multiple chronic conditions, we began to better understand really it's women, it's people of color, it's rural, it's LGBTQ plus, and it's low income. And we need to better understand by those demographic factors what the challenges are. So, in our mission to improve the health and economic security of 40 million older adults by 2030, we've been benchmarking against those demographic groups and prioritizing those groups. And I'm proud to say we're over halfway to our social impact goal, having improved the lives of over 26 million individuals. And last year, over 70% of those individuals were women. Women coming up short when it comes to meeting their basic needs, wanting and needing to go back to work, challenges navigating chronic conditions like hypertension and diabetes, experiencing falls, and caregiving. So with this survey, we were able to better unpackage what women truly have to say. And so a few of our key findings, let me share those with you. 79% of women surveyed and 67% of rural women said they're not financially secure today, never mind into the future. More than 7 in 10 low-income women say they're not confident about their ability to plan and save for retirement. And roughly a third of women and half of low-income women say their retirement income or savings will not be enough to pay their monthly bills And that's an increase from last year's survey. So when we dug in and asked women, are there ways that we can help? What are your thoughts on what would make a difference? We found some good news. There is bipartisan support, regardless of party affiliation or generation. We found that women feel there are some things that could make a big difference. So, most important for women was the importance of the government providing better assistance for low income older adults struggling when Social Security is not enough. Women also identified the importance of improving Medicare and Medicaid to cover home care and direct care supports and services, as well as expanding Medicare to cover the full range of treatments for various chronic conditions. So there's a lot of hope in that bipartisan agenda, and women know what works.
Sorry about that. I had to get myself off mute. That's it's fascinating. It really is, and it's such important research because it's a little bit scary actually to think about what the reality of it is and how slow sometimes those policy initiatives take place. So we're very thankful for the advocacy work that the council is doing on this. It's phenomenal. So I know that the council's research over the years has also looked specifically at the impact of caregiving on a woman's ability to plan successfully for retirement. So based on that, or just on, your own experience, what do you feel are some of the most impactful findings you can share that bring real attention to that challenge in particular?
Sure. Well, caregiving is absolutely a big part of why women are in a precarious financial position, often in the here and now and later in life. The caregiving infrastructure in the United States is quite antiquated. I mean, women and women caregiving hold up the rest of our economy in so many ways. We saw that during the pandemic when some of the care for children and for older adults was not as available. And who stepped out of the workforce, who stepped into the caregiving even more so? It was women. And women caregiving support the rest of our entire economy. And yet we haven't updated so many of the private sector practices and policies to better honor and support and compensate that caregiving contribution. But what we found in our What Women Say survey is that women that are caregiving are experiencing challenges even more so than women at large. They reported to us that they're often delaying appointments for preventative treatment and health care, compromising their own health care in the near term and the long term. They're cutting the size of their meals and skipping them because they just don't have enough resources. They don't have enough money to care for their loved ones and care for themselves. They're delaying or not filling prescriptions, skipping dosages. Um, they are taking less than prescribed to stretch it out or stop taking prescriptions altogether because there's just not enough money. They're spending hundreds, if not thousands, on the care of their loved one because it is just what families and what women do, but they're sacrificing their own health and financial security. They really just don't have enough money to care for that loved one, never mind save for their own needs, those emergencies and long-term costs. And what we found overwhelmingly is that women caregiving feel they themselves are one crisis away, one job loss, one health incident away from plummeting into poverty themselves.
Yeah, I think you and I have talked about this before. It's incredible, the snowball when you really take a step back and look at the big picture of this, the snowball effect that it has that creates this cyclical problem where because we don't have the resources to support caregivers when they're younger, it causes this detrimental effect on them, which carries over into their ability to plan for retirement. And then they in turn need more support themselves in aging. And we have this endless cycle that never gets broken because we're not really getting at the root cause of the issue. So it's hard to hear, but I think it's issues that we need to really face. So, Kaylee, so along with that, because I know the college has also done, coming at it from a different perspective, has done research related to retirement income literacy through our retirement income literacy survey, which really, I think, aligns with the findings of the research that was just discussed by Ramsey. So would you mind telling us a little bit about the college's survey findings, why they matter, and kind of talk about that in light of the larger discussion as to how we can improve retirement preparedness across the entire population?
Right. Okay, great. Thank you, Joellen and Ramsey. That was a really great conversation starter, especially for the retirement income literacy survey. So similarly to the results that were found in your study, The Retirement Income Literacy Survey supports that in similar findings, particularly for those who are below what we consider the $100,000 in investable assets. So just a little background for the people on the call. The Retirement Income Literacy Survey has been a study that we've been conducting at the American College of Financial Services for the last decade. Started in 2014 through the Retirement Income Center and was really tied to the RICP program. And really the focus was to better understand what was happening with consumers in terms of understanding not only the accumulation, but the decumulation stage. So when you're no longer saving for retirement, what are some of your knowledge base on what happens post-retirement? How much do you know about Social Security, Medicare, things along those lines? And over those iterations since 2014, when it was first initiated or conducted, is that we've done it every 3 years since, and each iteration has somewhat of a change. So initially it started with individuals who are only age 60, so really pre-retirement, to 75. And then there was a later addition to individuals who were in the 50 to 75 range, mostly because adding that additional demographic really helps us maybe better understand ways in which we can help people who are maybe on the cusp of, having time to maybe transition into retirement a little more confidently or have more readiness. And then in this last iteration, we had increased prior to 2023, we had only people who had participated or responded had to have a minimum of $100,000, $100,000 in investable assets, outside of their primary residence. That has changed. We wanted to get a better snapshot of Americans across the board and better understand, I think, Ramsey, to some of the individuals that you're communicating about, people who are quite vulnerable financially, both from like an earlier stage, but certainly as they get closer to retirement or start encountering health conditions. And so the study is really focused on understanding the knowledge base of consumers. So the study itself looks at 12 domain areas. And so, for example, some of those domain areas include Medicare, housing and retirement, investments, annuities, life insurance, longevity, planning for long-term care. And so what we did is there's a quiz, and actually we will link in the chat to the quiz. You can in fact take it yourself, and as professionals, you can see your score. But what's even better is actually there's a link in there that you can share with clients or prospective clients, and maybe even address some of the areas in which perhaps your clients their literacy levels maybe are lower than expected, or they all of a sudden realize that they have some questions or not feel quite as confident in certain areas. So I would encourage you to take that. But the study that we had released this year, we had 3,765 respondents. It includes men and women. And it was focused on all asset class individuals. So people who would be considered a little more vulnerable, but certainly people who were in the more wealthy asset classes. So people with 1.5 million in investable assets or more. What we've found in our study, I think I want to address the concerns that people addressed in the study. So similar to what Ramsey, you were talking about, is that people's top concerns right now, men and women, they're very similar, are cuts to Social Security. So this concern around, will I be able to depend on Social Security? Inflation. How is inflation going to impact retirement? These are the number one concerns out of the list of things that people could be concerned about. And then that's promptly followed by the cost of healthcare and paying for long-term care. So when we think about, collectively speaking, what's causing maybe some concern or distress among Americans, they are things that, one, cuts to Social Security and inflation. Those are really kind of systematic issues. Individuals themselves maybe don't have a ton of control over what happens with inflation and or what happens to their Social Security check. But what we do kind of find is that with knowledge around those things, we see a reduction in stress and distress around areas of concern. That's also true for costs of healthcare and understanding what that may mean. And then also considerations for long-term care, because similar to this idea around caregiving is it's not just what happens post-retirement, it also happens during accumulation stages, particularly for women. And then of course we see that reduction in overall retirement readiness to the start. But our retirement income literacy survey found that on average of all those questions that I talked about in those 12 domain areas, the quiz, individuals, just consumers in general, scored in a 31%. So collectively speaking, just a 31%. And then when you start to break that down, women are at 29%, men are at 34% on average across all those domains. Where we see some interesting findings between men and women is that women actually scored higher in two areas. One being housing, understanding housing. They scored a 47 compared to their male counterparts at 46, and long-term care. And they scored a 25%. So we're not talking like super stellar numbers here, but in general, they scored higher than the 22% that men scored. And so what we're also seeing is that there was a similar score between men and women in Medicare understanding at 42% across the board. Why this is kind of important is we see that women are carrying traditional knowledge roles actually even in their financial literacy scores. Because if you look at every other score, investments, annuities, retirement plan, understanding, tax strategies, Social Security, it is significantly lower than their male counterparts. And this is particularly important for Social Security, given that women, and I think Ramsey, you even alluded to this, that women depend on Social Security in a lot of ways for retirement and their financial security post their working years. Yet they scored a 29% in Social Security knowledge compared to men who scored a 36%. Now, one thing that we found was also slightly interesting is that women, there's this well-being piece. And I think, Ramsey, you were talking about this like stress, right? That comes along with perhaps like being afraid of not having enough money. Women just in general have a lower financial well-being score in our study than men. Women scored at a 43, where men were at a 46. And women traditionally just had lower confidence levels when it came to retirement confidence when compared to men. Now, where we see some of the cooler findings is that if there is a professional in place or someone who they identify as the knowledgeable expert. So we asked, do you have an ongoing relationship with a professional financial advisor? And for those who do, no matter what asset level, so people below that 100,000 or all the way up to the 1.5 million, we see that there is an increase in knowledge across the board. There is a decrease in like financial anxiety and stress. So we see an increase in financial wellness, and we also see an increase in retirement confidence. So what I think the largest thing here is that the study shows that for people, no matter what that level is, particularly for women, there is such an impact outside of just what's happening and perhaps gains that is benefiting consumers from having an expert help them through some of these difficult times, whether it's things they have control over or not, whether it's making a good decision on financial or Social Security planning, or whether or not they can control inflation. It's just about having that expert and that knowledge. So
Kaylee, one short follow-up question with that. So, you know, all the research findings are fascinating. I know for probably majority of our audience here today are practitioners. So what I love to do at the college is all about applied research and knowledge, right? So how can we take this and use it in our day-to-day career to help our clients and benefit society? So bridging that gap between research and practice, what, in your opinion, should financial advisors take away from those results? How can they use that effectively in their practice?
Yeah, there's a couple of different things. One is to recognize your own power, like just how much influence you have as professionals and what that can mean for your clients, like just that is such an important part. And so often we spend so much time in the numbers that, you know, there is this like latent impact of stress reduction. So one, recognize the impact that you have. Two is having hard conversations, which I'm sure everyone in this call has had. As practitioners and planners, we certainly are dealing with, you know, great successes and great stories and new births and all of these fun things, but we're also dealing with, you know, challenging, difficult decision making. And when our study shows that only 1 in 5 people have a plan in place for long-term care, and that's not just a plan, do I have an insurance plan, a long-term care insurance plan? That's just, do I have a plan in place? That's 1 in 5. We're talking about people between the ages of 50 and 75, not 25 and 75. And so people who are really at higher risk of maybe perhaps needing that, we see that almost 2 out of 3 have not even looked into making a plan or considering long-term care. Or how do I make sure that that caregiving burden isn't passed on to someone else? So I think having some hard conversations about what that may look like, what the options are, and encouraging that conversation perhaps earlier rather than later. And I think Mary will be able to talk about what this looks like for, you know, in her practice, and be able to really provide some suggestions there and some experiences. And then also just recognizing, honestly, that only 1 in 5 people actually selected that 70% will need long-term care in the future. And so there's also having real conversations about the realities of aging and caregiving. And especially when we see that nearly half don't even think that they're likely to need any kind of care or service. So with that, I am really looking forward to getting a little bit more into the nitty-gritty.
Absolutely. So let's shift the conversation, and this is, you know, great, fascinating background knowledge to have going into it. Let's start digging into some of the specifics. So, you know, in preparing for the webcast today, and just as part of my normal research and reading I do as a part of my role, I, you know, recently read a statistic that stated the average caregiver is a 49-year-old woman who works outside the home and is giving her mother 20 hours of unpaid care each week. And just to put that in further perspective, researchers have also stated that women providing care of any type, so this is for parents, children, etc., are providing unpaid care right now, which is worth anywhere from $148 to $188 billion each year. So it's just an absolutely staggering amount of time, effort, focus, etc., that women in particular, obviously there are male and female caregivers out there of all ages and backgrounds. But again, for today, we're talking about the women. Ramsey, I would really like to know, to again, taking big picture down to in deeper picture from a policy perspective, where do you think we're failing women in terms of easing this financial burden? Because this time, this lost income that they're spending in caregiving, that's the value. If they were paying an outside caregiver, you know, to do this, that caregiver will be getting paid for it. They are not getting paid now, and they're also not able to work as much. So policy wise, where do you think we're failing them?
Well, Joellen, those statistics are just staggering, and they really punctuate the point that women are holding up our entire economy. And with that caregiving contribution, we're just not honoring it. I mean, really, so many of our private sector and our public policies, those public policies and those private sector practices, they were created in the 50s and 60s when we were using rotary phones. And today we've got the Apple Watch, we've got the iPhone, and we haven't updated the policies in the private sector practices to better recognize women's role in the workforce and to really, really acknowledge that incredible contribution of care to young children and family members that are ill, individuals with disabilities, and elderly family members. I mean, we are just simply failing women across the board. We do know there are some public policies that could go a long way in making the difference. And there's bipartisan support from what we've heard. Women say, regardless of party affiliation or generation, that a tax break to family caregivers to take care of the true out-of-pocket costs, which can be hundreds, if not thousands of dollars when providing care to a seriously ill, disabled, or elderly family member, would go a long way. As a matter of fact, 96% of women surveyed across the aisle, both sides of the aisle, believe a tax break would go a long way. They also believe alleviating the workforce shortages for elder care and disability care to ensure that home care workers are available by providing them competitive wages and benefits would go a long way. The reality is, with the demographic trends, and we're in peak 65 with over 11,000 people turning 65 every day this year and for the next several years, and those individuals will get to live 2 or 3 more decades, we're going to need millions of direct care workers. And if we don't address the need to really honor and compensate that work, we'll never be able to meet the demand. But in addition, we really need to take a good hard look at long-term care, both the products, but also a role for government, an appropriate role for long-term care financing, because it is such a huge unexpected cost Medicare does not cover. And that is a sneaky little fact that catches up to you when you least expect it and least can afford it. So we're long overdue at taking a good look at that as well.
Yeah, absolutely. It sounds to me from what you're saying, to really address the issue, it's going to have to be a public and private solution, because I think employers and the support that employers can provide to the women and other caregivers is also a huge part of it, in addition to the policy, for sure. So Kaylee, I know you have lived experience here, in that you've served as a caregiver for loved ones, and also, again, you have your expertise not just in research but in financial planning and advising itself. How, taking a look at yourself as both, a thought leader, researcher, and as a person with, financial planning expertise, how did your own caregiving experience affect your financial well-being?
Well, so I think I'm going to step back just for a brief moment. So I started in my 20s actually caregiving. I had a mother who was terminally ill with cancer. I was in the later part of my 20s, but I had been like just kind of climbing the ladder professionally for a while. And then during her illness, I certainly had to take a step back. And in that process, it was not only just taking a step back in terms of time, it was also taking a step back in terms of trajectory. So, what that meant is that I was not seeking additional promotions, I was not seeking additional responsibilities, which certainly would have helped pay back my student loans from my private undergrad education. And also helped contribute to my own retirement planning. And I recognized that I was a primary caregiver at a very young age, but it also impacted not only career, in addition to the regular things that caregivers go through, exhaustion, the emotional distress, just some of those things that are across the board that, the financial part doesn't really, that's just a small portion, but it certainly limits the ability to, I think, have trajectory. And, for me, I only had, my mother was ill for 2 years versus an illness that I think would continue for an extended period of time, or some kind of caregiving responsibility that would be, consistent and prolonged. And since that stage in my life, I have a blended family. I have children, and now I am the plan for my aging father. So I felt like I've lived the last 3 decades in a caregiving role. And so in this new decade, my father, who lives in another state, certainly I have to not only pay for travel, but care. And I have said in the past, there's no way we could have gotten him a long-term care policy at this stage. He certainly wouldn't have been able to afford it had he been even 60, because we had passed this kind of health stage when it would have been certainly more affordable and been very helpful for myself. But, I am the plan. And I don't think I'm unique. I think a lot of people, and women, and particularly not just women, career women, but just women in general, we are the plan.
It's a great, yeah, by accident or design, it's where it ends up. Because again, people don't want to face their own mortality. They don't want to consider that the worst case scenario might happen to them, because that's a terrible way to go through life, always worrying about that also. But then you end up getting blindsided, unfortunately. So Mary, you've been sitting here so patiently waiting for us to get to you. And I feel like really the meat of what we want to talk about today, a lot of it's going to come from you. So I'd love to learn more about your perspective on this, not just in terms of your expertise in financial advising, but also your lived experience as a parent of a child with a rare medical condition. And not only that, I know your father had also suffered from Parkinson's disease. So kind of like Kaylee, taking off your financial planning expert hat for a second, can you tell us a little bit about your lived experience and how that impacted you and your ability to control your financial future?
Yeah, thank you for having me. And I love these two women. They're powerhouses and I love hearing from them. So thank you. Yeah, I wasn't a caregiver when I was 10, but my dad was diagnosed with Parkinson's when I was 10. My parents are older, so I am one of the younger people probably in the world that has experienced their parents going through a terminal illness, long-term care, hospice, all watching a parent deteriorate, becoming a caregiver, having that relationship come to a caregiver relationship, which is completely different from a parent-child relationship, taking a driver's license away, like all that stuff that none of my generation has even thought about. I am your lived experience. So if you can do anything, start to get to the me's. The 40s and the 50s, we are not prepared, and we are going to be very frustrated with the systems that are in place. So like we are the people that are gonna feel all of this in multiple ways. And just take it from me, Kaylee, all of us, like we want to make the road better. My biggest frustration with being a caregiver is I have to trudge a new path, and the person behind me is going to have to trudge a new path because there's no cookie crumbs for me to follow. I didn't know what an adult family home, hospice, skilled nursing, like, I don't know what that is. I don't know where the Sherry's menu is that shows me what those things are or how I like pick them. I don't know how to visit them. My dad doesn't definitely want to go into those, but he would have loved it if I could have shown them those things. So I just think it's really a system, like Ramsey said, that was built on a dial, and now I have an iPhone and I really want the systems to be on an iPhone. So I think it's just like our generation is going to be frustrated. They are not prepared. Please share as much information with them as possible about what is coming. It's hard. It's not going to be fun. Straight up. So just like Kaylee, I made decisions after college to move close to my dad. He was at that point, he was 40 when he had me. So he was not young when I was in my 20s. And so I made the decision physically to move closer to him. Me and my brother shared some of the duties. I was his POA. I was his person, right? So I was also pregnant with Ruth, my second daughter that has a rare disease, when my dad passed away. So I'm destined to have a neurologist in my life. They are cool with me. We talk the same language somehow. But I know now that I was practicing with my dad. The real crazy advocacy came with my daughter. So that was 2016. Dad passed in January. My daughter was born in June. Just saying that out loud makes me have some trauma I obviously haven't dealt with completely. So just bear with me. But yeah. And Ruth had intense medical care. She had seizures. I also started this job that year. It's fine. Studying for my 7, dad passes away, gonna have a baby, company goes through a transition. Seems fine, right? Like you can only handle a lot. You can handle a lot as a caregiver. So I was just handed a lot at one time. But I thought I can have a flexible job. I could take care of my dad, and it happened to be that I could take care of my daughter. Now, I wouldn't say financial services. We sell it as flexible. I love that idea in theory. In reality, it's intense. You set your own schedule, which is cool. But if you're a type driver, your calendar is going to be full. Did I schedule major surgeries in? Absolutely. Did my practice not grow as fast as others? Absolutely. Was I okay with that? Absolutely, right? So I think as caregivers, we take on jobs so that we can build in buffer, or you have to have a very, very reasonable employer that's going to understand all the things you're going through. So that's my world. I'm in the rare disease world. I have these posters. I was blessed to know Ruth was going to have a rare disease when I was pregnant, because most rare diseases don't get diagnosed for 8 years. And then you're in the dark trying to throw darts at a board. We knew, and I'm actually really, truly believe we're lucky to know, because I know what our path was. I knew what the doctors we needed to talk to. I knew all those things. So that was really a gift for us to know that path. Not all caregivers are the same. Not all paths are the same. And so, yeah, I wouldn't change my path. I'm glad I know it. I don't know how to tell more people about the hard part of it and the glorious part of it, but that's why I'm here, I guess.
So given that, thank you for sharing that story, Mary. And I'm guessing you've probably been on autopilot out of necessity for years now. So then again, so thinking about your I know your practice is called All Needs Planning, and it is inspired by and driven by your own personal and lived experience, and you wanting to help intervene in the lives of other individuals who are facing some of the same challenges. So I want to talk about a couple of things about your actual practice.
Yeah.
And useful information for anyone who's on the call today who is is either already serving. I mean, everyone on the call today, if they're a planner, is serving women, right? Is a retirement planner. So whether they center their practice around caregivers or special needs or whatever, they're invariably they've got someone who is a caregiver who is one of their clients. So focusing just on the special needs aspect of it for a parent who has a child who is likely to be facing a lifelong disability. In special needs planning, we talk about, planning for 3 retirements or having multiple lifetime cash flows or retiring for 3. Why don't you explain what that, as we get started here, explain what that term or that concept means?
Yeah. So 2 cash flows, if we're very technical, if these are all technical financial planners. So our lifetime as parents, and as these women have completely pointed out, our cash flow in our lifetime is usually based on one income, possibly, because one parent is staying home to take care of the disabled child, and that one parent is usually the woman. So it's not only are we trying to plan for 2 cash flows, 2 lifetimes, and when I say that, one, we're paying for things in unpaid labor and actual money for our children. So unpaid labor is what I like to call, what we're calling that bucket of what women are doing, is that 30 hours, and it's not parenting. Okay, so I want to make the very distinct. There's a big distinction between a parent duty and a caregiver duty. Okay, and the caregiver duties are in a separate bucket that we allocate a cost to. The reason we do that for our families is because when you're not here, I'm not going to live forever. Surprise. Who's going to do that job? How much is it going to cost? And what does that look like? And we have to plan for that in the second cash flow. So Ruth also won't live with us forever. Like, I love that a lot of parents come in thinking that that's the reality. I can't caregive forever. This has aged me. I'm 43 and look probably like 55. These grays are coming in super hot. So I can't caregive forever. And I would rather transition Ruth to a housing solution when I'm here and able, right? That's going to cost money while I'm here, while I'm retired. It's going to cost money when I'm not here. And what does my estate look like? And how am I going to dump into it effectively to make sure she's taken care of? So that's the 2 cash flows, and most likely built on one income in the higher working years.
It's a tremendous amount of pressure and tremendous amount of weight to be on your shoulders. I know you desperately want her to have as happy and healthy a future as she possibly can. So then thinking about this difficult discussion, again, you're coming into this with your clients having walked the walk, right? There's probably people on this call who are serving these clients, want to better serve these clients, but maybe don't have the same lived experience as you. So what is the first step that you usually take, again, with your expertise, when someone comes to you for advice and they're juggling work, caregiving, trying to plan for their own financial future, maybe financially supporting their parents, which is taking away from their own retirement contributions, or like you just outlined, thinking about, I'm not just planning for my own future, it's also my child is going to be dependent on me. So how do you open the door to having that very uncomfortable conversation?
Yeah, definitely. So 2 things I would do: start, take the shame away from them coming in already feeling unprepared. They already feel bad. They are going to say, I should have been doing this. Whenever somebody says should, that's a shameless that they have a tally of, that they haven't done things. Okay. So just take that away. Be like, hey, nobody comes to me and says they have everything together. And Mary, can you just give this a once over? Nobody's doing it perfectly. Obviously, from the statistics of 31% of confidence, like that's a big confidence measurement to me is a big deal. Like that means that they know about it, but they're not confident about it. So let's take the shame out right up front. Second thing to do is ask, are you caregiving for anyone? Okay. Nobody asks that. Your book of business has a lot of these people in it, and you haven't asked that question. You're only planning for their retirement, possibly college. You're going to miss a huge chunk of the planning that needs to be done. So are you caregiving for anyone is a very easy question to ask at an annual review. In a first meeting when you're asking about their kids, dates of birth, all that things, their family tree, if you're asking about their family tree. Are you caring for elderly? Do you have siblings that possibly need your help? Are you caring below? Are you caring all the way around, right? Caregiving is a very specific word you can use to ask those questions. I mean, I looked up a statistic, but like 7.3 million kids are getting an IEP. That's 15% of the school district. So if you're like, it's not in my book, I don't have clients like this, that's baloney. You have clients like this. You just haven't asked the question if they are actually doing caregiving rather than parent. So those are my two big ones. They're not technical. They're very emotional based, but like take the shame out of just not doing the work already and ask them, are they caregiving for anyone?
Well, I know it's right on point. Kaylee and I just happened to be sitting in on a research read earlier in the week or last week, and they were talking about how even though a lot of financial advisors will actually claim that they do have some confidence when it comes to helping families like this plan, there is this tiny little percentage of advisors who actually have on their company's standardized intake questionnaire any questions about this. So how in that initial interview are you even going to elicit the information that is incredibly impactful for their financial well-being?
You
So
have to be brave enough to ask the question. It
right,
is very personal, but
right,
that's your job. That's your job.
right. Exactly. And look at what with Kaylee actually and what Ramsey was saying in terms of the financial insecurity that is the reality of it. Let's like put two and two together and realize that this is where a lot of it is coming from. So
Yeah. And I would say that's where you start. The two other things that you can do very easily, always have both people in the meeting. If there's two married parents, get them both there. Even if the husband's like, the wife doesn't want to do this, she's not wanting to be involved in it. I don't care if she's bored out of her mind. You need both parties at the meetings. And make them Zoom. It doesn't have to be in person. For a family that's taking care of a kiddo with a disability, getting two parents to your office without their child and trying to get childcare, respite, whatever it is, those things don't exist outside of the mom doing it. Make it Zoom. Make it easy for them to get on the meeting and be present, and then learn their love language financially. Okay. If the woman's bored, show some visuals. Is he analytical and she's visual? Great. You need to adapt to both then. Like, don't let her off the hook of being involved, because her confidence level isn't going to increase if her husband's the only one going to the meetings.
absolutely fascinating. So how do you help families strike a balance between ensuring their loved one needs are met while still preparing for retirement? Because I would imagine that there's this tremendous tug of war going on between, yes, I know we should be funding our retirement account, but XYZ is preventing us from doing that right now. And it's like that, what they say in the airplane, put your oxygen mask on first before you help the person beside you. So what, in terms of phrasing, what's your go-to, where you try to help people begin supporting, or putting away for what they need?
Yeah, this balance is the hardest. So our whole goal is to give our kids an amazing life. That life just happens to be past our life. And so the balance between making sure we're here with them and we're enjoying our kids and we're doing the things that we want to with them and not sacrificing the future planning that we have to do is an ongoing discussion. And I think I really learned it when I had some ALS clients, because we would have a husband possibly with ALS that's like, I want to make sure she's taken care of because I'm not going to be here very much longer. And she's like, I want you to love your life right now because you're not going to be here much longer. Right. And so it's always can we start easy with savings and have a wonderful life? Can we 1 year really, really bear down and we're just going to put a bunch of money away? It's an ever evolving conversation. That's why you have to have on annual meetings. That's why you have to be in front of these people. You can't let 4 years go by where they're either on one side of it, where like, we're going to Disney World, we're going to Europe, we don't care how much it costs, we'll pay for a caregiver to come with us, versus the person that's eating rice and beans and missing appointments and not taking care of themselves and sacrificing everything to put their money into this pool for the future of their child, right? There is always a give and take between those two. We really just try and get to know the family and make sure we're one spouse is going to be on one side and one spouse is most likely going to be on the other. So we have to find that middle ground between them. But that's the hardest part. So if you want to know, the first hard question is, any of you are a caregiver? The second hard question is, what do you want your life to look like now, in retirement, and when you're gone? And so those are even harder questions for them to get their heads around. But it's not just going to put this into a calculator, Excel doc, and like, bloop, 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 this is how much you need in retirement, and you're off to the races. It's every year you're really, really looking at everything to make sure both parties they're not going to be happy because it's a compromise, but they're both getting a piece of something that they want with their family. And also, like, we didn't even talk about benefits, but the whole goal of our planning, keep our kids benefit eligible if they're in it, give an amazing life. Systems don't love each other because we can only have $2,000 in their name. Ramsey, I hope, is working on that somehow because it's ridiculous. So, like, that's the crux of the puzzle, right? We need our kids to be on those benefits, because without that, we're really not going to have enough money for basic needs.
Well, and this is why, again, Kaylee, getting back to her point about like why there is a benefit, whether it's financial counseling, whether it's a financial advisor, whatever, at whatever level of support that it is, it can make a huge, huge difference. So wrapping up our conversation, I want to spend a few minutes with one last question for Ramsey, and then we'll hopefully, I see some chat and web. I'm not sure if we have a specific question that we can go through, but I'll take a look at that as well. But Ramsey, before we got to that, I wanted to wrap it up by bringing things back to potential larger scale or long-term solutions for this issue. You mentioned a couple of times about the bipartisan aspects to your research. And I know that you've had some really interesting results from that. Can you just kind of rattle off what were some of the solutions that through your research you proposed that had the greatest support from across both sides of the aisle?
Absolutely. And for this audience, I just want to reinforce Kaylee's point. Know your power. To Mary's point, you are wayfinders and navigators and advocates to help people find their way. And guess what? It's not their fault. It's a challenge. The true cost of aging in America is extraordinary. And it's because so many of our public policies don't provide the comprehensive coverage that people think they're going to get once they're eligible for Medicare and once they start drawing down their Social Security benefit. We can do something about that, however, when we found that overwhelmingly there's support among women, all ages, all life stages, when it comes to shoring up some of these programs we all rely upon to age well. So again, over 96% of women believe a tax break to family caregivers would go a long way. 92% of women, all ages, all party affiliations, believe addressing that workforce shortage around elder care and care for individuals with disabilities would go a long way. So would government assistance to help lower income older adults pay for basic needs like food and medicine and utilities, housing and transportation. So many of those programs have those antiquated income eligibility guidelines and asset limits that keep people $1 over from getting that support. And women overwhelmingly feel it needs to be modernized and updated to reflect current realities. And that goes for the Federal Supplemental Security Income Program as well, also known as SSI. Overwhelmingly, women believe it needs to be expanded and enhanced and modernized. It's a benefit that pays a monthly amount to individuals with very limited income who are disabled, blind, or 65 and older, and it's a lifeline. But it hasn't been updated in decades, and the monthly allowance is not enough to live on. But in addition to financial security, retirement security proposals, we also asked women about health and healthcare because we know your health determines your wealth, and your wealth can drive your health status. And we heard from women that they believe Medicare and Medicaid should be shored up so that it covers home care rather than really leaning hard on nursing home care. We know home care works and people want to age and live in their home. And it has a real savings in terms of keeping people independent and healthy. So 94% of women feel we should improve Medicare and Medicaid around home care. And then women believe that low-income older adults should get help enrolling in the programs that can help with food and medicine and other basic needs. Women also believe we should expand Medicare to cover evidence-based health promotion and disease prevention programs. 80% of older adults experience 2 or more chronic conditions. So think hypertension and diabetes, arthritis. And yet, right now, it depends on your zip code, whether or not you have access to programs that actually can make a difference. And women believe we should remedy that and expand Medicare coverage to include the full range of treatments that can help with those chronic conditions. So there are some solutions there. Frankly, there's a blueprint for policymakers if they're listening to what women, and especially women of color, rural women, women caregiving across the nation have to say about what it takes to age well in America. And we want to make sure we get that message out. So thanks for providing the opportunity to share.
We're so grateful for the work that National Council on Aging is doing because, again, we can't all be all things to all people. And when I think about someone like Mary, who is boots on the ground and is one by one helping these families, and Kaylee generating research out there that's hopefully going to be, educating advisors on a large scale, we're relying on organizations like yours to really hold the feet to the fire in Washington and try to get some of these things pushed through. So I'm glad you're here. So we do have, I'm just going to scroll through here. I apologize if I miss someone's question here. I want to say that if there is a question that was posed here, and if we have your contact information and we don't get to it right now, because we do only have a couple more minutes, one of us will try to get back to you in addressing that question. So I see Cheryl asked, is there a list of federal or state services or benefits that are available to aging women on limited income? And Ramsey, I think you're the one to answer
Yes.
that.
I love that question. So NCOA provides a free anonymous tool. www.benefitscheckup.org. Benefitscheckup.org is a free service we provide. You put in a few pieces of information, zip code, income, and then we will tee up hundreds and thousands of programs that are there for us that often we don't know about. It will curate the programs by your zip code. And of course, your income eligibility will provide you information on the programs, what it takes to be eligible. We'll refer you to a local community-based organization that can help you enroll in those programs, or our national call center that can assist. Now, I'll tell you, to Mary's point, it's not easy to navigate these benefits and programs, but it's your time to save, and caregivers, older adults, individuals with disabilities are often leaving billions of dollars on the table when it comes to these programs that can help. So check out benefitscheckup.org and make sure you bookmark it and share it with clients. They may be providing care because if they can put those dollars back into their wallet or into their retirement savings account, it will go a long way.
That's great. So I've gotten the slide up here. So we're any other questions that we have in here? There were a few really good ones that came through here. We'll definitely get back to you offline on that. So thank you to my panelists. This was an absolutely fascinating discussion. I feel like it's just a bottomless, ocean of important things that we need to discuss, and we just barely broke the surface here today, but hopefully it inspires more conversation. So if you do want to learn more about how you can better serve families, whether they are caring for a child with disabilities, an aging parent, et cetera, the college is the only college in the country, educator in the country who's offered a designation that's specifically designed for that. I'm very proud of our designation here, the Chartered Special Needs Consultant. So there's a QR code there, or you can go to our website. Also on our website, we are having a advanced special needs planning symposium in November in Phoenix. And registration very recently opened up for that. So please go to the college's website and look for that if you are interested in doing a really deep dive on this stuff. It's going to be a lot of great presentations. And also a little bit of a plug for the college's Knowledge Hub Plus platform, because again, our whole point here is to effectively educate and improve, the level of service that all of our alumni and students are providing their clients. So the college recently launched something called Knowledge Hub Plus, which is what we call our just-in-time learning platform. In my opinion, is very reasonably priced, and you sign up for it and you get an entire library of continuing education on wide range of subjects. Almost all of it, or if not all of it, is eligible for CE, for PRP, for your college designation. Strongly encourage you to check it out. Thank you again to Kaylee, Mary, and Ramsey. I can't have asked for better panel members. Thanks so much for your time today.
Expand your opportunities at theamericancollege.edu.